Quinidine gluconate is a medication used to treat or prevent various types of irregular heartbeats, such as atrial fibrillation. It can help improve your ability to carry out everyday activities by reducing the number of irregular heartbeats, although it may not eliminate all irregular heartbeats. The medication works by blocking abnormal signals that cause irregular heartbeats. Your doctor may also prescribe other medications, such as blood thinners and beta blockers, to help reduce blood clots in the heart and slow your pulse. It is important to follow your doctor's instructions for taking quinidine and any other prescribed medications. The dosage and timing of quinidine should be determined by your doctor based on your specific medical condition. Before taking quinidine gluconate, it's important to do a test dose to check for any allergies. You should take this medication by mouth, with or without food, and a full glass of water. It's best to take it on an empty stomach, but if it upsets your stomach, taking it with food may help. After taking it, make sure not to lie down for at least 10 minutes. Make sure not to crush or chew extended-release tablets, as this can cause too much of the drug to be released at once, increasing the risk of side effects. Also, be aware that there are different brands and forms of this medication, so don't switch without talking to your doctor first. The dosage of quinidine gluconate will depend on your medical condition and how you respond to the treatment. If you're taking it for an irregular heartbeat, the manufacturer recommends not taking more than 4 grams daily. While using quinidine gluconate, it's important to avoid eating grapefruit or drinking grapefruit juice, as this can increase the chance of side effects. Also, try to avoid making large changes in your dietary salt intake, as this can affect how much quinidine is absorbed by your body. To get the most benefit from this medication, be sure to use it regularly and take it at the same time each day. If your condition doesn't improve or gets worse, make sure to tell your doctor. Some common side effects of quinidine gluconate include diarrhea, nausea, vomiting, loss of appetite, stomach pain, or a burning feeling in the throat or chest. If any of these effects persist or worsen, notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risk of potential side effects. Many people who use this medication do not experience any serious side effects. However, you should inform your doctor immediately if you experience any serious side effects, such as nausea or vomiting that does not stop, changes in vision, muscle pain, signs of low blood sugar, signs of infection, easy bruising or bleeding, extreme tiredness, dark urine, yellowing of the eyes or skin, or aching/swollen joints. Seek medical help right away if you experience very serious side effects, including severe dizziness, fainting, or sudden changes in heartbeat. Although rare, a serious allergic reaction to this drug can occur. Contact medical help immediately if you notice symptoms such as rash, itching/swelling of the face/tongue/throat, severe dizziness, or trouble breathing. One type of reaction, known as synchronism, can occur even after a single dose of this drug. Contact your doctor or pharmacist if you experience symptoms such as ringing in the ears, sudden hearing problems, headache, blurred vision, or confusion. Your dosage may need to be adjusted. Additionally, certain long-acting brands of quinidine may appear as a whole tablet in the stool. This is the empty shell left after the medicine has been absorbed by the body and is harmless. This is not a complete list of possible side effects, so if you notice any other effects not listed, contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. Before starting quinidine gluconate for your irregular heartbeat, it's important to talk to your doctor or pharmacist about the potential risks and benefits. This medication is typically used for carefully selected patients. Quinidine, which is an antiarrhythmic drug, can be very effective in treating irregular heartbeats, but it's important to note that it can also rarely cause new serious and potentially fatal irregular heartbeats. It's crucial to follow your doctor's guidance closely when taking this medication. The daily dosage and the best time to take quinidine gluconate will depend on your specific medical condition and should be determined by your doctor. Be sure to discuss any concerns or questions you have about this medication with your healthcare provider. Before taking quinidine, make sure to tell your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions or other issues. Also, let them know your medical history, especially if you have certain types of heart disease, low blood pressure, a history of easy bruising/bleeding, severe muscle weakness, kidney or liver disease, asthma, or any current infections with fever. Quinidine may affect the heart rhythm, causing serious symptoms that require immediate medical attention. This risk may be increased if you have certain medical conditions or are taking other drugs that may also affect the heart rhythm. Additionally, low levels of potassium or magnesium in the blood may also increase your risk of heart rhythm issues. It's important to talk to your doctor about using quinidine safely and to avoid alcohol or marijuana while taking this medication. If you are an older adult, you may be more sensitive to the side effects of this drug, so be cautious and consult with your doctor. During pregnancy, this medication should only be used when clearly needed, and if you are breastfeeding, consult your doctor before continuing to breastfeed while taking quinidine. When taking quinidine gluconate, it's important to be aware of potential interactions with other medications. Always keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with quinidine include large amounts of antacids, certain antibiotics, antifungal medications, and protease inhibitors. Additionally, quinidine can affect the removal of other medications from your body, which may impact how they work. It's important to talk to your doctor about any other medications you are taking before starting quinidine. Be cautious about using medications containing quinine while taking quinidine, as they are very similar. Always follow your doctor's instructions and never start, stop, or change the dosage of any medicines without their approval. If someone has taken too much quinidine gluconate and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of overdosing on quinidine gluconate may include severe dizziness or fainting, hallucinations, and seizures. If you or someone you know is experiencing any of these symptoms, seek medical attention right away. It's important not to share quinidine gluconate with others. While taking quinidine gluconate, you may need to undergo various lab and medical tests to monitor your health, including complete blood count, liver/kidney function, quinidine blood levels, and EKG. Make sure to attend all your medical and lab appointments, and consult your doctor for more details. Remember, it's vital to follow your doctor's instructions and attend all necessary appointments to ensure the medication is working effectively and safely for you. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take an extra dose to make up for the missed one. When storing quinidine gluconate, make sure to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. When it comes to discarding the medication, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly dispose of the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal of quinidine gluconate. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.